Good morning. I'm going to get us started. We have 9:30. This is Ed Crowe, and today we're going to talk about the UHC Care Advantage IESNP plan. It's a PPO plan that we have that's available in 29 states. We're going to talk about the details of the plan, go over why it's something good to have and why it makes for a lot of easy enrollments for you. Before we do that, a couple things. When we do webinars, if you have questions, send them into the question section. And I suggest if you can, just send them in as we go along. And in fact, we just had a question come in right now. So the question that just came in, I'm going to hit that in just a little bit. And what I'll say is ask questions during the webinar. I'm not ignoring you. I'll answer them at the end because I just can't do both, unfortunately. Wasn't given that ability, I guess. So questions send in. At the end, I'll answer those. And having said, and the last thing I was going to say is we record all these webinars. So we record them and put them on our YouTube channel. So if you miss this webinar or don't make it, you make it halfway through, this will be recorded. It'll be put on our YouTube channel, which is at Crowe Medicare, or you can just Google YouTube Crowe and Associates. And we'll also email this out to you. So anybody who registers for our webinars, whether they attend or not, they get an email of the recording. Okay, so having said that, let's get started. So Care Advantage plan, I'm going to talk about it specific to New York. So it is available in 29 states. We'll look at a map at the end. It's a 5-star plan in 28 of those states. New York is one of them. I get a lot of commission questions about this. It's the full regular commission for any United Medicare Advantage plan. So full allowable commission, and it's paid direct to you by the carrier. So this is not an LOA or we own the book kind of situation. It's like any normal United product and you're getting paid direct, the regular full commission. This plan is available to dual and non-dual clients throughout the year, and that's because of the 5-star rating. It's got a PPO plan design, same PPO network as United has on their other Medicare PPOs. The benefits are really strong, especially in New York. The max out-of-pocket on this plan is $1,300. So when you compare this plan to other Advantage plans, non-dual Advantage plans especially, it looks really, really good. $2,400 a dental, $255 a quarterly OTC. Just continue with the benefits here. $200 vision benefit, $2,000 hearing benefit, 36 rides. The plan in New York does have a $35 a month premium. I will mention that if anybody has any level of drug help, so if they had Medicaid or any level of help, copay help, drug help only, the premium for this plan would be paid in full. So any drug help paid in full. You can see the counties that it's available in there. Obviously, I'm originally from New York, so you can see some of those counties are from out in Rochester and Buffalo, and then obviously we have the ones near the city as well. But there are the counties, just let you take a quick look at that. People have asked me a lot, will they expand? Yes, but as I'll talk about in more detail in a minute, they have to have a clinician as employees for every county they offer this plan in, so they have to staff up, so it makes it slower when they roll out counties for the plan, but they do plan to add additional counties down the road in New York. However, it is a PPO plan design, so it'd be the full PPO network. These are just the counties where you can enroll people. So who has the ability to offer the plan? It's an exclusive product offering. So the only agents that can sell this and get paid for it are agents that are part of Pinnacle Financial Services, because Crowe is affiliated with Pinnacle. So if you're part of Pinnacle Financial, an agent or through an agency affiliated with Pinnacle, or Crowe and Crowe's affiliated agencies, those are the only people that can get paid on this product. It's not available through any other upline. You could sell it, you just wouldn't get paid on it. So who's eligible for the plan? So it's eligible to duals and non-duals. So on the dual side, obviously somebody with full Medicaid or a Quimby, a Slimby, and some states that have the ALMB level, and ALMB would be eligible for the plan. So if somebody is getting some level of help, the first step is you check in Jarvis to see if they're eligible for the plan. They may be eligible already, but you have to check Jarvis. And one of the triggers is help. So if somebody has help, don't assume they're eligible, check it. But once you do, if it says they're eligible, you're good to enroll them then. So what if somebody has no level of help? Well, they're most likely not already going to be automatically qualified. And those are the people that you have to do a phone verification for to get them eligible for the plan. So no drug help, check Jarvis quick, but they probably won't be automatically eligible. You can do the phone verification, and if they get through the phone verification, then you can enroll them. So the phone verification is a call, and it determines people's eligibility for the plan, and that's based on their struggles with activities of daily living or instrumental activities of daily living. Now, what's an instrumental activity of daily living? I had no idea either, and I'm going to show it to you over the next slide or two. So if people have difficulty performing regular ADLs, and that's the ADLs we're used to with long-term care, like eating, bathing, you can read through the list. But if they have difficulty performing those things and that's identified on the call, then they'll be eligible for the plan. The IADLs, instrumental activities of daily living, are much less specific. They're much more broad. And they're things like basic self-care tasks, housekeeping, managing money, food prep, managing medications. Maybe people have pain when they tie their shoes. Well, on this phone call, if it's determined that they have some of those things, they will be eligible for the plan. I always make the joke that I'd probably be eligible for the plan because it's, for IADLs, it's fairly broad, and you'll have a lot of people that will meet the criteria. So if you have to get somebody approved through the phone assessment, it's a company called WellSky. It's a third-party vendor that United Healthcare uses. And WellSky sets up the call, the agent actually schedules it, and then WellSky performs the call. And the client only needs to be verified one time. There is no re-verification process. So once you get somebody through on the WellSky call, they're in. They don't have to requalify every year. So if you need to do a WellSky call, once you're set up, you would go into the system, you would schedule that WellSky call in the system. And then when the WellSky agent calls and talks to them, they're going to take a 10 or 15-minute call, ask a series of questions, and they're going to make the assessment the same day. So again, remember, phone verifications to get people in the plan is needed if you look in Jarvis and they're not automatically eligible already, and Jarvis will tell you. As I mentioned, the phone verification is 10 to 15 minutes. You can schedule the call days prior to the meeting, weeks prior if you want, the day of the meeting. The only thing you can't do is you don't want to enroll somebody and then schedule the call for later, because if you enroll them, the enrollment will go through, but if they fail the WellSky verification and they're not eligible, then they're going to get disenrolled. So do the WellSky call beforehand, and you schedule the time as the agent. This plan does have a clinical aspect. That is what slows it down from being made available in additional counties right away. So all members in this plan have access to a licensed clinician, and that's either a nurse, nurse practitioner, or a physician's assistant. And those people will go on site to visit the member, whether they're in a facility, at the home. They'll go there and see them on a regular basis that is determined by the care coordinator. So somebody enrolls in this plan, they get a call from the care coordinator. The care coordinator asks a bunch of questions and determines how often does somebody need to go out and see this person. Now, if the person doesn't want somebody to see them, they can certainly say so. You know, they don't have to come out and see them. But a lot of times people find this of value, especially when, you know, family members maybe have a parent that is kind of isolated and they just want somebody to go in and check up on them. And the clinician, if they're scheduled to go in there once a week, twice a month, they'll check their meds, make sure they're doing okay. So it really is a benefit to a lot of people. The clinician that goes and sees the person is an employee of United Healthcare. So it's not a third party. So if you want to offer this plan with the benefits, how do you get ready to sell? So basically, if you're contracted with United Healthcare right now, you're almost ready to go. You just got to be contracted with United Healthcare and either contracted with Pinnacle as your upline or with Crowe as your upline. If you have one of those two uplines, you can sell this plan. So it does require an additional certification. The way it would work is if you're with us, you can call us. If you're already contracted with United Healthcare, contact us, say, I want to get set up to sell this plan. We'll request that the certification is loaded into the invitation only section on Jarvis. You complete the certification. You'll then get an onboarding email from WellSky. Once you set that up, then you're ready to go. You're certified to sell the product then, and you can schedule appointments through WellSky. The enrollments can be done the usual methods, either paper enrollment, you can do it through Lean, or you can do it through Connecture and Sunfire. It's on both platforms, Connecture and Sunfire. We offer that to agents at no cost. So you would just use that platform to enroll them. The value of this plan and why you'd want to offer it, first of all, it's a 5-star plan and it has it looks like a dual plan. Obviously, there's a lot of good extra benefits. It has a low out-of-pocket max. Makes it a great option when you compare it to non-dual plans. So somebody asked me the question earlier, and I'll get to all the questions later, but somebody said, why wouldn't you sell this to duals? You could sell it to duals, but as a dual, I mean, you're not really getting extra benefits. Dual plans already have a lot of benefits. The person to sell this to is a drug help only person who's in a regular Advantage plan, or any person that qualifies that's in a regular Advantage plan. I mean, compare the benefits of this plan to a normal MA, and it's a very easy sale. It's an easy move. So that really is the sweet spot. And then the other one is to replace med subs. If you just simply do the math on this, when you've got a $1,500 out-of-pocket max on a plan, or it's in some states it's $500, it depends, but when you got that low of an out-of-pocket max, just do the math, and it makes a lot of sense to replace supplement, especially in New York. States like New York and Connecticut, they have super expensive supplements. I just talked over my slide. I do that all the time. It's super annoying, but it's a good replacement for plans F, G, and N, especially in New York. You can utilize the trial right. So the trial right means if somebody's been on nothing but a supplement, you use the 5-star rating of this plan to move them into this Advantage plan. That person has a trial right. They have a 1-year period where if they don't like the Advantage plan, they can move back to their original supplement. And as the agent, you can put them back in it if they want, and then you would get paid on that business. So it's a great way to let them try the plan. You've got the 5-star to get them in it, and then they've got to get out of jail free with the trial right if they don't like it and want to go back to their supplement. Either way, you'll help your client and you'll win as the agent. So what I'm going to do in a minute is we'll go on the site. We have a website for this that shows all the states the plan's available in, and I'll show you how to click on the state. Well, you'll know how to click on the state, but I'll show you how to select the state and look at the benefits of the plan. It's on the Pinnacle site. I put the URL there. You do need a Pinnacle username and password to access this, however. Just wanted to mention that. And as I mentioned before, if you're already contracted with UHC and you're through Crowe or Pinnacle, you're all set. We just got to load the certification for you in the invitation only section. You take the cert, get the WellSky email, and you'll be ready to go. So let me go and show you there we go. So here's the site I was talking about. This is the site for the plan. As you can see, you can scroll to the states. So list the benefits up top. And as you can see, in some states, the out-of-pocket max is as low as $500. For example, in Washington, the dental benefit is $7,000. But we're looking at New York. So if we click on New York, there you go. So it gives you the benefits, gives you out-of-pocket max, the premium, tells you the counties it's available in. And if you want to see the enrollment guide, you just click on that. And there's the enrollment guide, so you can look at the benefits of the plan more specifically than what we're talking about. And you can see primary 0, specialist 0, inpatient hospital is only 150 a day, and again, it has a 1,300 out-of-pocket max. So it's a really strong plan, especially in New York. Okay, so that's what I had for content. Remember, we'll record this, put it on YouTube at Crowe Medicare if you want to watch it. And anytime for a future webinar you want to attend, we'll email you, anybody who registers. You don't even have to attend. If you register, we will email you the copy of the recording. Let me see if we have questions. So the question was, why not sell this to dual clients and why? Well, you could sell it to a dual client. It's just not as effective, I wouldn't think, because obviously dual plans have very strong benefits anyway. Maybe you could sell it to a dual for the clinician aspect of it, because again, you get a lot of people who want somebody to come out and see them, especially somebody who is a medical professional. Would you think someone who has difficulty with transportation for MD visits, etc., would satisfy the IADL requirement? They may. They may. I mean, if they have trouble getting around the house, or if they have trouble with transportation, it's fairly broad, but it's hard for me to say if they absolutely would qualify or not. For that person, you really, if they're not automatically eligible in Jarvis, you just have to do the call. It's not a long call to see if they qualify. Where can you search the participating MDs and hospitals? It's anywhere, it's the regular United PPO network. So you just search wherever you'd ever search for a United doctor, whether it be Connect or Sunfire, UHC Doc Find, anywhere like that. Does the client need to meet both ADL and IADL requirements to qualify? No, it's a combination. If they have one ADL or if they have a couple IADLs, it's a combination. They don't have to have both. We have found that, and even United recommends that you talk to your client, coach them a bit before they do this call, and explain to them how it works. Our acceptance rate is in the 70% range on these. Again, IADLs are fairly broad. Let's see if we have any other questions. It looks like, unless somebody's typing, it looks like that's it. Well, thanks for coming on today. I appreciate it. If you have any questions, certainly just give us a call here at the office or send us an email. That'd be fine. And appreciate you coming on today. And I hope everybody has a great day. Thanks.